Cat owners, do you struggle with medicating your feline? Whether it's a pill or liquid, many cats will give you some degree of resistance. On this episode of the Paw Report, we sit down with pet behaviorist Dr. Sally Foote to discuss the best ways to train and ultimately get your cat to take important meds. Stay with us.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Oh, do we have some useful information for cat owners today? And what better person to talk about some spicy cat care is our resident veterinarian and animal behaviorist, Dr. Sally Foote. We are so glad. You know, it's been 13 years since we've been doing this show, and 13 years you've been a part of it. So thank you so much today.
I'm glad you guys always like to have me back.
Oh, we do. And today it couldn't be any better because you're an expert at cats, and you know, trying to coax a reluctant feline to do anything that they really don't want to do is extremely difficult. Yeah. So why are cats a little bit more edgier than dogs?
Okay. Well, okay, so it's to understand like the behavior of the cat, meaning like what do cats need where they live to feel happy and safe. And every animal's behavior really does still stem from when they were wild, you know, when they're not living in our homes where everything's safe and sound, where there could be risks or trouble out in the world. So cats are both the predator and the prey. What does that mean? Cats kill things that are littler than them, and they're killed by things that are bigger than them. So most things in the world, like humans and dogs, etc., are kind of bigger than them, meaning that they're going to want to really sort of hunker down, hide, or avoid when something is unusual, they've never experienced before, like a touch or approach. And so they'll go more into hiding, and while they'll be slower to strike or bite, they're kind of suppressing that buildup to when they say, no, I'm going to have to swat at you, or I'm going to be hissing at you or try to bite you to really make you stop. So we don't judge that. We don't see it as obviously as we do in the dog. And part of that is because if, you know, the wolf might eat you, if you look really scared, they know, you're easy prey. Mm-hmm. So while they may be scared, they'll be like just sitting there like quietly, like that, you know? Mm-hmm. So dogs, because it's easier to read, like, okay, what do you like and don't like? And secondly, like, are you scared? Are you getting aggressive or not? We kind of know what to do and not do. And then secondly, just also by eating behaviors and such, dogs are more motivated to eat like something really good as compared to a cat. Because cats, when they prey, they're going out and pouncing on mice or snakes or whatever. And half the time they're successful, so they're just about like eating appetizers all day long, you know. And so they're not as motivated. Say they can be food motivated, but it's a little more challenging to find like, okay, Kitty, what gets you happy to tolerate what I need to do right now? Because we have to pair the two. The last thing I would say too is our dogs and puppies, we take them out on walks. We put them on a leash. They ride in the car. They go to all sorts of places and things, and they get very socialized. They get very accustomed to different noises, different people touching them, etc. Cats, not so much. We don't take cats out on walks. Right. We don't take them in the car ride. So now when maybe we do need to bring them into the vet and they don't really quite get as much regular, you know, care as compared to dogs, to the cat, then it's much more like, I'm not accustomed to this, I'm not used to this. So then we go back to, they duck underneath the bed and you can't get them. Or they're hunkering down and they're hissing, which is always saying, "Don't touch me," you know. And then they may strike real quick with their paw, or perhaps even attempt to bite.
So all those things kind of go back to our, I guess you could say, our title of this segment, which is Spicy Cat Care. And we're talking about especially when you have to medicate your cat, you know, when you have to give them medicine and all those fun things that go along with that. I guess before we even launch into how to, is it really, should you have another person with you, or can you handle this process alone?
You know, I think that's an excellent question, and one logically you would think, oh, I need a second person to hold my cat tight. Yet, going back again to sorry, it's my stuffed kitty, folks. If this kitty, as I go to reach, says, oh, I don't know if you want me to touch me, our logic thinks, oh, more people to hold him down. But that stresses him out more, because now he feels more trapped. So the more people, the worse it is. So there are some creative ways that we can hold the cat while the cat does not feel held, that we don't have our hands on them. Yet, yes, sometimes I need you to stay in place while I put in your eye drops, or I put in your ear drops, or I need to give you an insulin injection, or something like that. So more hands is worse. Definitely worse. I've got a great video on my YouTube channel showing one of my clients, wonderful man, with his older kitty, I think her name was Molly. Anyway, how she was in the carrier base like this because they needed to give her a B12 injection at home. She was an elderly cat, and that was part of her health. He says, oh, we had showed her, she was fine for us in the office with how we did it, showed him how to do it, but he says, oh, it's not going well at home. I said, well, bring her in for the recheck, and I'm going to tutor you how to do it. So we had her in the base of the carrier, and we showed how just giving her the blop of the baby food. So she's eating the baby food. Before, only touch was a wipe of the alcohol and then put in the B12. And then I handed the syringe to the man because there was a second injection she needed. I said, now, Bob, you do it. And I said, now remember, no hands. He was like, okay. And you could see when he gives a shot and she just was eating and fine, his face was so happy. I said, that is the key. She's in the base. You can put the food down first so she's eating. That's how she pairs. Oh, it's good to be on this table and in this carrier. Because actually the needle prick is not that bad. That's not the hard part. They're not getting upset about the needle prick. They're getting upset about
the handsy, being handsy.
Sorry, I've got a stuffed cat today.
Now, what about administering liquid medicine versus pill form? I mean, are there some tricks of the trade that you can do, you know, putting the liquid in water, you know, different things that you can try?
Sure. So so medications like antibiotic and different medications, they may be available only in a tablet form. They may be available as a tablet or a liquid form. Overall, some clients find tablets easier to give just because we can hide them in what's called a pill pocket. That's like the super yummy, like gummy stuff you can cover the pill in. And then when we tip the kitty's head up, and when you open the mouth and drop the pill back, they'll want to swallow it because it tastes good. Okay, now the trouble with pills in cats is immediately after giving them a pill, you need to give them 6 milliliters of water to wash it all the way down the stomach. And that is often not advised just in general. I mean, it was a study done about 15 years ago that shows cats were getting irritation in the esophagus if we didn't chase, you know, the pill with water. So it kind of gets to be more of a two-step process. Personally, I like liquid better, so we would avoid that. Now, some cats, they're trying to fling their head. So here's the tips with liquid. Find my little syringe here. I had it here. Kelly, oh, here it is.
Yes.
Okay. I never liked eyedroppers. So ask your veterinarian. These are the regular, they're a 3 cc syringe, so 3 milliliters. Most often when we're giving a cat liquid medication, it's only maybe 1 milliliter. So it's only about like this amount. I don't know if you see it. Okay, here's the rules. Always approach a cat 90 degrees to the nose. We're human, and we always think straight to the face.
On.
But this to the cat is very threatening, and it is a natural response. It's called a menace reaction, that if I reach my hand over this cat's head by the eyes, he's going to pull away because it's a way of self-protecting the eyes. So now I've got a cat who's backing up, and then you see how the struggle begins.
Right.
So now if I come from the side, and I just take my forefinger under the jaw to tip the head up, the syringe always go in the corner of the mouth. Not the front. You go in the corner like this, right where the lips meet.
Okay.
Right there, and you're only going to squeeze in like 1/4 of a mil at a time. So he swallows that little bit down, little bit down. Now, sometimes with liquid medication, I would advise the client, add a little bit of hand baby food to the liquid so it tastes good. And also, lastly, some medication is bitter tasting, even in a liquid form. Unfortunately, they don't give us a bitterness guide to medication. Found that out with gabapentin. But there are ways, and we have wonderful apothecaries. The pharmacies, that make up from base medications, and they can flavor it according to anything you want your cat might like. So now this flavored liquid medication can be a lot easier to give to the cat because it's a flavor they like and it can hide the taste. Very lastly, if it's really difficult, because it can be, and I have a YouTube channel and I have a couple of videos showing how to give a cat a pill the low stress way, how to give a liquid, Anyway, very lastly, sometimes it's still like, man, he just doesn't want it in his mouth. Maybe he's got a sore tooth and you're trying to treat that. So you can see how that's dually difficult.
Right.
Transdermal medication. Transdermal medication is where the medication is made in like a gel type form, not a liquid, sorry, but a gel form. And it's usually rubbed on the inside of the ear. It can be rubbed on the back of the neck where you shave a little fur. And then the skin absorbs the drug to get in the bloodstream. Now, some drugs absorb well this way. Some we really don't know because a lot of studies weren't done. I'm always an advocate if this is the way that is the least stressful for the animal to possibly get some medication, let's give it a try. And I did do on a recent one of my Facebook Lives, a presentation about do we achieve blood levels. It was with a certain drug called gabapentin in cats. And it's possible that when we do in the inner ear, the cat may groom that off and eat it, but honestly, then they're self-medicating. They're taking it by mouth and it will get absorbed that way. So, and sometimes it kind of trick cats and putting the transdermal like on the front leg, well, they will groom it off themselves or okay, now you're really going to get the med that way. So there are a few tricks, but I think the most important thing is straight up tell your veterinarian, pill isn't going to work. Or I've always had a lot of difficulty giving pills. Is there any other option? Just please add in those words, is there any other option? Because sometimes my head just goes, oh, pill, easy peasy, do it this way.
Yeah, because you do it every day.
Yes, I do it every day. But I've got to put my eyes to the client's eyes, And so if they say, do you have any other options? Then my head will go, well, yeah, we do. We've got transdermal, we have tasty tabs, we have liquid. Then now I am in a conversation with the client. Now the client can say, oh, I can do a liquid, or forget anything about the mouse, Dr. Foote. What's that transdermal stuff, right? And then I could perhaps prescribe that.
When I was kind of studying some things about giving, because I don't have a cat, so I don't know how procedures should happen. But what I did read about was time, how time is such an important thing to consider when you're giving your feline medicine for a couple of different reasons. Don't give it to them when you're in a hurry and you're leaving for work, or maybe it's some time consideration for the actual cat, nap time, feeding time. Is that important? To consider when you're thinking about, okay, I've got to give, Rover it's medicine now. Right.
So first of all, and I recently did a workshop at my learning center called Spicey Cat Home Care, and it is available on my website through the shop because we recorded it. But my biggest point, and I showed in the demonstration, was how we create the medicating center, like how we make a nice place for the cat to come to and want to get their medication. Believe it or not, yes, it works. We do this. So what do? All right, say I have maybe a little taller than this, but anyway, I have an end table or something like this that I put a blanket on or something, a nice place to lay. And honestly, something like a towel or blanket like this, because I'm going to show you a way that you can use this to hold the cat. Remember we said fewer hands on the cat? Then we may spray it with the pheromone product, the Feel Away. So it makes the cat feel like he's already been there. But non-medicating days, I'm going to put a blob of tuna up there and say, come on up and get your tuna. Good cat. All right, go. Because it's getting him to like the spot, period. It's not always associated with medicating him.
So you can
You're training
essentially train
yes.
a cat.
Oh yeah, I've had clients do this within 2 days with their cats. Oh yes. So it's all about get the highest motivation for them. So this is when tuna, temptations, baby food, it's always going to be on the medicating spot. So that's, it's like a bigger paycheck, right, for coming here. And we're going to do this a couple times a day. Play with them. You could put catnip up there. You could give them toss their toy up there so they just jump up there to get their toy. So they're They're associating that. Now when it comes time to actually medicating them, when I bring out the syringe, I'm also going to put a plop of tuna. So we're pairing a reward for the cat for every step of giving them the medication. Because they know, get out the bottle, you get the syringe, I'm like, whoa. So I've got to make a good association with just the sight of this. And then besides, say, approaching from the side, you're by yourself, right? You don't have anybody to help you, but I want you to hold still. Getting the cat happy in like the base of the carrier, like this, helps them to hold still. You don't need extra hands holding them down. A second thing is that towel you've put on the table, and I'll just show it here, like as if we were really on a table. So let's say my little kitty here has been having fun every day, getting his temptations, but now I've got to get those eye drops in your eyes because you've got a nasty infection going on. So I would take the towel, I'll show it this way so people can see, come up around the neck, and this is just like a regular refrigerator chip clip, only on the towel, not on the cat's neck, okay? No scruffing. No, sorry, this is a big issue because we always used to scruff cats. It's the only way people saw to handle them. But actually it's very uncomfortable for the cat, and that's where they associate a lot of pain and avoidance with what we're doing with our hands. Mm-hmm. So this is to just clip the towel, okay, folks? Now you can see the towel is holding his body for you, and actually the towel kind of insulates from the feeling of hands on him. And then again, I can come from the side, tip his little head up, put the eye drops in, and we're done. And then I give him a blob of tuna afterward, so he likes the whole scenario, and away we go.
What about, because I did this with dogs.
Yeah.
Blowing on their nose or blowing in their face, is that just a tail, or is that really, could that help?
Okay, so in general, sort of like if you want to call it a calming thing or distracting thing, it can be helpful. So whatever you do, as long as you see like the cat's body relax, their ears are not turning back, they're not cowering down, then that's working. Sometimes also after, because when you do, say, a pill, more so, not with liquid for the blowing in the face, you had to tip the head up, drop the pill back, rub and wait for them to lick their nose. You might be going on the nose to get them to lick their nose. Because when they lick their nose, then they've licked the pill down. Because we all know the cat who's like, spits it out.
Right.
So.
What about the fear of getting bit?
Ooh, that's significant and real. I just recently wrote an article for one of my veterinary journals about, it's for veterinary staff, kind of let's remind ourselves of the essentials of low-stress feline handling, especially also considering for our personal safety, because the cat's mouth naturally has a certain bacteria that can readily cause infection, and because cats' teeth are very sharp, they're actually sharper than a dog's canine tooth, and most of the bites go to the hand, and where they go on the hand tends to be on the tendon. So when that sharp tooth penetrates into the tendon, there isn't good blood supply in my hand to bring like oxygen, so it festers very rapidly into a bad infection. Something like, of all bites that are presented to the emergency room, only something like 25% are from cats, but of those bites presented to the emergency room, 75% of the bites with infection are coming from cats. And I think it was 70% of people with an infected cat bite are hospitalized within a day because they need to get IV antibiotics, and 90% within 2 days. So when it comes to the cat, we really want to do these techniques that don't have the cat escalated. And if you need to wear gloves, I support glove wearing. Now, you're going to want a pair of more like articulated gloves that are easy to handle. Frankly, the work gloves now that are very, like, you can do anything with them. That is far more preferable than anything like oven mitts or welder's gloves. And there even is a specific type of glove that even has longer gauntlets. Just let's say you have rheumatoid arthritis, right? I mean, it isn't that your cat is bad or that agitated. You're like, wow, I've got to get these drops in his eyes every day, twice a day. I love my cat, but I can't take a risk on any kind of little nip of a bite or a scratch because I could get an infection because I have an immune-mediated disease. And you might even be on medication, right, that's suppressing your immune system.
Thinners.
Or blood thinners, it's another one, right, very good. So when you wear gloves, guess who gets tuna? Nothing else. You wander around the house. I'm wearing my gloves I'm going to use to care for you. I'm going to pet you with my gloves and give you. So the gloves are not associated with stress. Very important. Our safety tools need to not only be used in a less stressful way, but also let's have them around so they just get used to them and they're not, that tool itself is not creating stress.
What if your cat vomits, spits up, or worse, starts to foam at the mouth or drool? Yeah, is that, I mean, should you be panicked about that, or?
It's panic-inducing in people, you know. I'll never forget when I was a new veterinarian, there's one antibiotic called tribrissin. Again, they didn't give us the bitterness scale, right?
Oh.
So this antibiotic is a great one when a cat had upper respiratory infection, but this client calls, and I took the call, and she said, oh my gosh, it looks like he has rabies. He's got foam all over. I'm like, what? And the other older vet said, oh, it's that tribrissin, it's bitter. And when it's bitter, the cat will usually foam at the mouth. And so he said, just tell her to get a little bit of water, rinse out the mouth, and then we'll work on ways to make it taste better. So vomiting, it can be from the irritation or sometimes stress, you know, like they're struggling. That raises like the GI mobility, so they throw up. Or the drooling and the foaming is usually because the medication is bitter. They bit on the pill, it broke the coating, or maybe the liquid or whatever was just bitter, or the pill doesn't have, you know what I mean, a very good coating. So getting like a little syringe with water, you need to let your cat just rest for 15 minutes, quite honestly. When they have just vomited or they're drooling, it's like, okay, kitty, like go in the bathroom and just let you settle down. Then I'll get the water, and from the same way, from the side, squirt the water to rinse out your mouth. Then tell your veterinarian, we're having a little trouble here. It's very irritating, you know, or it's causing him to vomit, or you know, the drooling, because we're not sure then, is he really getting the medication? And not only is the whole scenario now creating, you know, the association and the behavior of fear and difficulty, and then the behaviors of the cat hiding, it's like, well, you may not be getting, you know, the antibiotic you need, the blood pressure medication that you need, you know, the treatment that this cat needs for their health care. So we need to know, and actually we need to know exactly, rather than saying, oh, it's really tough to give it to him. Okay, how tough is tough? What's happening? You know, I want to hear, as I give him the pill, he runs behind or he's struggling, and then after I get the pill down, he gags and he vomits within 5 minutes. I want to hear that. Okay, I want to hear, I can get the liquid down, but oh, then he just has copious amounts of drool coming out of his mouth, and I rinse it and it's okay, but I want to hear that, because that's telling me more specifically the effect of what like this med is it bitter or not? And secondly, how now, okay, this is an associated, you know, experience for the cat. It's going to make it difficult to give this medication, especially if it's one that might be needed to be given long term.
Bottom line is, when should you call in the vet again? I mean, you're at your wit's end, you're worried about your pet, they won't take it, they spit it up. You've tried everything that you could possibly think of. When is enough enough?
Okay, I think we're in a wonderful age of technology. Just about everybody has a smartphone. So within the first or second attempt or time of giving a medication, if you're finding the vomiting, the drooling, he's running away, he won't let me do it, email is fine, because in the email, you can email and say, doctor or staff, because we have a lot of licensed veterinary technicians, so like the nurse to an MD, okay, that's my assistant who is knowledgeable of care. They can field at least, okay, he's drooling, we're going to need to get, say, probably a liquid medication, then I'll check with the doctor and we'll get that represcribed. I want the email that describes exactly what's going on, and that's easier for you to type out, right? And then secondly, a video. Video yourself giving the cat the medication. If the first time it was kind of tough, just set up your cell phone, hit record on the video, and give your cat the medication. Even if everything goes better the next time, it'll help you to see, oh, what did I do that's better? But if it's like, oh, it's really difficult, you attach that video to the email. Now I can see what you're describing to me. And now I can know better, oh, wait, we need to educate. Maybe the client's coming from the front. And you've got her husband and daughter hanging on the cat. I've had that happen. I'm like, no, he said a different way. But, you know, it's hard to remember everything you've been instructed to do, right, in one
Right.
little minute at the vet clinic. So if we see that and we're like, okay, no, this is a non-bitter product. It's because of how we're holding the cat down. Here, you follow this video to watch and see how to do this. Or we want you to, put the towel down, use a little clip, and do it a different way.
Right.
Now we know what's going on. So send a video, send an email. Start with an email.
And watch videos that you
Yeah, I've got a
actually
lot on
prefer.
my YouTube channel. Yeah.
Well, as we wrap up our time, and of course we spent the better part of today talking about cats and felines, and I think it's appropriate that we remember a very special cat and feline that's been in your life and our lives here on the Paw Report. So we say farewell to our buddy Ranger.
Yeah, Ranger was a mascot at Oka Veterinary Clinic, and he came to our lives about 17 years ago, jumping out of the semi-truck at the Road Ranger in Tuscola. And he lived at the clinic and was an ambassador. He would go to schools, etc., and he's been on the Paw Report a lot of times.
Yes, he
he's in a
has.
lot of my videos showing the right way to handle cats, etc., and just some fun, goofy ones too.
Yes.
So,
Rest in peace,
yes,
Ranger.
rest in peace, Ranger.
And thank you, Sally, of course, for coming on for 13 years here on the Paw Report. Again, it's our segment today. We affectionately titled it Spicy Cat Care, and there's more on your website if people need to turn for guidance and support on giving their cats medication. Thank you, Sally.
You're welcome. Thank you.
And thank you, our viewers of the Paw Report, for joining us for this episode. We hope you'll stick with us next week.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.